Now it's my pleasure to welcome Dr. Supreet Chopra. She is a very young cardiothoracic surgeon from Bhilai, Chhattisgarh. Welcome you, ma'am, to WCC 2023, and just share with us your experience for the first day of WCC. How did you feel?
I think it was very informative, and all the lady cardiac surgeons and cardiologists coming together on a similar platform and talking about academics is a great treat for me. And I feel that like we have invited a lot of male cardiologists also.
Yeah.
Very soon, I think this would be the only platform existing in near future, I guess, like people are getting interested, or the male cardiologists also getting interested in this.
Yeah, now it will be the reversal. Previously used to be
Yes.
the male conferences and the females were called as a
Absolutely.
guest.
Now
And
it's
now
gonna
it's
be-
the reversal, that female cardiology conference and the female predominant conference,
Absolutely.
and the calling the male colleagues as a guest also. So really good to see such kind of revolution.
Absolutely.
And regarding your talk, ma'am, you discussed about the
Revascularization.
differences in the revascularization, how females are different from the males. Can you summarize briefly about the differences?
Yes. Briefly, see, a lot of studies since ages have been performed, and they've been trying to look into short and long-term outcomes in males and females both, even after adjusting for the confounding factors of baseline characteristics
Yeah.
also. But recently, there have been studies which showed predominantly that women were more prone to mortality and complications, and were also associated with a lot of comorbidities associated with coronary artery disease, which was speculated that it was probably because of the coronary anatomy and their anatomy, biological factors, and late presentation of females,
Yeah.
and association of more comorbidities in females is also one of the factors which resulted in poor outcomes in females. But we still are lacking some of the long-term outcomes as well. So I think there should be greater and large-scale study should be done where we assess short and long-term outcomes.
Yeah.
Both
Can
in
you,
humans and
ma'am,
males.
can you tell us some data about the revascularization in male versus female population? Because as far as I can judge is that more of the female undergoing the revascularization as compared to the female population. Maybe because the females are reluctant, there is unacceptability to their symptoms that they is having some,
Okay.
or some other kind of bias is there.
Yeah. See, I'll tell you stage wise. Like, first of all, the presentation of coronary artery disease is different, slightly different in females as
Yeah.
compared to men. That is one. Number two is because the presentation is different.
Different.
Because the presentation is different, they come at a very late stage.
Late stage.
Unless and until,
Undoubtedly.
so unless and until the female has succumbed heavily to the coronary artery disease, she will not come. She will not
Yeah.
report, because most of the females, they present with dyspnea, back pain.
Until and unless I've seen
headache.
that they don't become crippling because of their symptoms, they don't come to the.
They don't come. They don't come. And because like a decade back, there was like people believed that females have lesser coronary artery disease, so they are protected by their hormones.
Yeah.
Females usually present late because they are, most of the times, I tell you, a lot of RMOs also, a lot of doctors that females go to, they present with ऐसा पेन हो रहा है, वैसा पेन हो रहा है, एटिपिकल पेन, they're like, नहीं, हार्ट का नहीं,
pain, right? Yeah.
हार्ट का नहीं है, it's muscular and all that. They present a lot of females present with toothache,
Yeah.
dental pain and headache, back pain. So they are considered like हो सकता है vitamin deficiency हो, calcium deficiency हो,
Because they
muscular
have
pain हो.
atypical symptoms.
So
Yeah.
all of that has led to the scenario that females present to us very late.
Late, yeah. And what do you think that how the age group is now changing? Like whether
Absolutely.
previously we used to have like postmenopausal because of that estrogen export goes away, and now what about the data in the young females coming for the coronary?
Fresh data that we are having in a large scale study in 2022 and 21, it shows that younger premenopausal women are presenting, and they have poorer outcomes as compared to postmenopausal. Can you believe that?
Okay, that's really very
Yes.
alarming also. And what about like your journey in the COVID time? because in COVID we have so much mortality, not only in the males but also in the female population.
Yes.
Any data if you can share with us about the myocarditis and other vascular
Yes.
injuries, male versus females?
What I have seen in my practice is a lot of during COVID also and post COVID as well. Like long COVID syndrome was happening, and
Yeah.
a lot of males and females both were presenting with sometimes typical and sometimes atypical presentation. Even the coronary artery disease, not just the coronary artery disease, even the valvular heart disease.
Yeah.
Valvular heart disease also was presenting
For the first time?
not for the first time.
For the decompensation.
People were coming post-op cases were presenting to me where acetron was not working that well.
Okay.
Because of the
DIC
hypercoagulability,
and hypercoagulative state.
So all of that was happening. Plus, prolonged COVID syndrome had resulted in angina and heart attacks more often. They were more prone to psychological and psychosis, basically psychological imbalance and psychosis, and because of stress and all, they were presenting. So all of that I was seeing in my practice post COVID. And I'm seeing that till today. A lot of patients come to me even today, like with palpitations.
Yeah.
And lately, I'll tell you, for the past 2 years, I'm watching this. You can't believe it that most of my patients, like around 70 to 80% of my patients, are suffering with vitamin D, vitamin B12 deficiency, and stress and palpitations of unknown origin.
Okay. Yeah. So thank you so much, Dr. Supreet, for sharing your valuable, amazing inputs, and have a wonderful stay today.
Thank you so much.
And we'll be having a next day and hoping to see you tomorrow also.
Sure, I'll be there. Thank you so much.
Thank you.